I think everybody was affected by the tragic floods in Texas. Here at Avan, we wondered what we could do to help. We reached out to some of our partners, Direct Relief and the Texas Association of Community Health Centers, and they put us in touch with Frontera Health, and we scrambled one of our mobile clinics in order to help them reach out to those that had been affected by the floods, offering them primary health care, behavioral health supports, and a lot of other things that they just don't have access to. We were able to get down there and see them in action. This is what we saw.
Hi, my name is Renee Zimmerman. I'm from Frontera Healthcare in Menard, Texas. I'm a nurse practitioner. My community has been devastated by the flooding on July the 4th, and I'm here today because I was loaned out this unit and we're able to go to the people in my community to give medical and behavioral health care. This patient I'm seeing today, tell us what kind of devastation you had from the flooding. 5 inches so lots of cleanup, lots of mold exposure, lots of allergy symptoms secondary to the mold.
Yes.
So another mission that we're on is making sure that our patients have all medication, that they have food, their utilities are on. And an important component is how are they coping? How is their mental health? When you see your neighbors devastated by what happened on July the 4th, our community, we come together, we support each other, and we do whatever it takes to take care of each other. We're very resilient, and I don't know when and I don't know how, but I know we'll come back from the flooding.
International Medical Corps is just that. We're an international nonprofit that goes around the world and helps people in times of crisis. We look at both their physical and mental health. It's really kind of a wraparound services perspective. Been working in the United States since Hurricane Katrina, helping large emergencies, small emergencies, just trying to really understand where the gaps are in the healthcare system, helping local healthcare agencies and networks really learn how to respond, build more efficient systems for the future, and then think about in the immediacy how we can step in and give a little bit of relief on the healthcare system and kind of assist our partners. So here in Texas, we are working with Frontera Healthcare Network, and a lot of what we're doing is focusing on more of like the mental and behavioral health components, which is why we're partnering with them on their mobile medical unit. It is one of these strategies that we think is critical in these kind of environments. People are really spread out. Finding them, understanding what their needs are, seeing the impact in their own homes provides a sense of trust and comfort to really discuss not only what their medical needs are, and I know that can then be addressed pretty immediately with having a baby here, but also if they have other kind of behavioral health needs, if we can connect them to long-term counseling. Some people lost everything, and it's not always easy to talk about it. Some people need 3 months, some people need 6 months. A healing and a grieving process is a very individual process. And so we just try to connect people to resources, get them what they need immediately, but then let them know that there's a community around them, and it's not just in this moment. And I think that's why partnering with local organizations that are embedded in the community and are from the community really ensures that the work we do in the short term kind of has a longevity to it because it extends beyond the community. So more and more the emergencies in the US are really going to be local. Emergencies are always local, but when you're in these counties where you have to drive long distances just to find where people are at, expecting them to come to you isn't always realistic. And so I think, looking at what this strategy means for the future, it's not just the emergency response in my mind, but it's looking at community health workers. It's looking at how do you build in a strategy of outreach to make sure that the sense of resilience is really there and helps the community go down. When you're on someone's home turf, so to speak, there's a level of comfort that doesn't exist if you're asking someone to come into a disaster resource center or a clinic. So I think it's been really great.
We went everywhere and we touched lots of lives. We got people resources they couldn't get. So that right there made our job easier. We can't thank you enough. We can't. There's no words. I could use every descriptive word that I have, but that is what you did for us is wonderful. We appreciate it. So We don't have money. I normally don't take lunch. I work for money. I mean, you know, who eats? Who eats?
I haven't missed many lunches. It was incredibly humbling to see these different organizations and individuals come together to build back a better community. This is the true heart and backbone of the rural communities in Texas that we've seen come together, and it's an amazing experience. Texas strong.